listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emran, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emran. Today we're going to be talking about anemia. Anemia is a very, very common medical condition, and it affects millions of people in the United States and across the world. It's estimated that almost 25% of the world's population may have anemia or be at risk of developing it. To date, we do know that there's more than 400 different types of anemia. Some are much more common than others, and so I thought today would be an excellent opportunity to break down some of the different anatomy that is necessary to identify anemia, some of the testing that's available, and some of the different types that people may be diagnosed with. Now, when we talk about anemia, the basic definition is a lack of healthy red blood cells. So the body has blood, which is made up of liquid parts and solid parts. Now, the solid parts include blood cells. There's red blood cells, which are what we're going to talk about today. There's white blood cells, which we talked about on a previous episode. That's based on the immune system's ability to fight infection. And then there's platelets, which are used for creating scabs. Basically, if someone has an injury like a cut or bleeding, a platelet will stop that bleeding. So today we're going to focus on red blood cells and that type of anemia. Now, a red blood cell has a very interesting shape. It looks like a beach ball that's been a little bit deflated. So it has to be round and flexible so that when it's pumped throughout the body by the heart and it goes through arteries and veins, it doesn't break apart. It also has an indentation in the middle of it, similar to a donut. And the reason for the indentation is to increase the surface area. So the red blood cell has a primary duty to carry oxygen from the lungs out to the rest of the body, and then to bring carbon dioxide back to the lungs to be exchanged for more oxygen. So the red blood cell's job is to carry oxygen and carbon dioxide throughout the body as efficiently as possible. Having that little indentation increases the surface area. Having that deflated beach ball appearance allows it to be very flexible without breaking apart. The one thing a red blood cell does not have is a nucleus, because red blood cells don't divide. So after a certain point, the nucleus is lost, and they're basically just carriers. They're basically just cargo ships carrying what they need to throughout the body. Now, many people wonder, why is blood red? Why is it that color? And the reason is something called hemoglobin. Hemoglobin is the chemical inside of the red blood cell that binds to the oxygen and the carbon dioxide. Now, the word heme is actually another term for iron. So heme, iron, is red, very similar to rust. And that's why the red blood cell and blood in general looks red. Now, when carbon dioxide is increased above a certain amount, the blood actually turns blue. And how do we know that? You look at your veins. So carbon dioxide is in a much higher quantity in your veins, and that's why your blood temporarily looks a little bit bluish. In the arteries, it's going to be red. In the veins, it's going to be blue. Now people say, well, when I cut myself, even if it's over a vein, why is it red? Because the oxygen in the outside world immediately binds to that blood. It's going to turn red. So you're not going to have blue blood typically outside the body. Okay. Now, what are some of the diagnostic testing that we do? The most common one is called a CBC, which is a complete blood count. And I did a whole episode just on that lab test because it's so important, and that's the most accurate way to diagnose initially whether a person is anemic or not. So we look at the hemoglobin value. If the hemoglobin value is above a certain amount, that means you're not anemic. If that hemoglobin number is below a certain value, then you are anemic, and then we have to do other testing to confirm it. Now, in general, there's three types of what we call pathology, what we identify when we do a CBC. So when we have a blood count and it looks a little bit abnormal, we actually look at those blood cells under a microscope. So when the pathologist or the lab tech looks at it under a microscope, they give us some values. And that tells us very quickly what type of anemia we're dealing with. So there's three types. There's microcytic, normocytic, and macrocytic. Okay? So microcytic, normocytic, macrocytic. What that means is, what is the size of the red blood cell? So if the red blood cell is a normal size, let's say it's 100, and that's the size that we're going to go by, that's normocytic. If it's less than that, let's say it's 75, that's microcytic. That means that red blood cell is too small. It's much smaller than expected, so that's a microcytic anemia. If that red blood cell is very big, meaning it looks inflated, then we call that a macrocytic anemia. And why is that important? Because it automatically tells us where the deficiency may be coming from. So a normocytic anemia means there's probably not a vitamin deficiency causing it. There's something with the blood cell itself that may be an issue with the circulation. When it's microcytic, we already know this could be iron related or a deficiency in a certain type of vitamin or mineral. When it's macrocytic, we know it's a different type of deficiency. Okay, so CBC, complete blood count, that's the test your doctor is going to run. Some of them can do it right in the office. We do it in the emergency room on many, many patients every day. We get a report back. It tells us if it's microcytic, normocytic, or macrocytic. The next test that we do is called a reticulocyte count. So a reticulocyte is a baby red blood cell. So remember we talked about blood cells are produced and then we look at them in the blood. When it's a reticulocyte, that tells us if the body is producing more cells. So if we have a very high reticulocyte count, that's good. That means the body is able to produce more red blood cells. If we're anemic and the reticulocyte count is low, then we have an answer. The body's just not producing enough. It's not able to keep up with what we have to do. Now, what is the lifespan of a red blood cell? Do they live forever or is it for a short period of time? So red blood cells in general live for about 100 days. So that's about 3 months, maximum 4 months. So a red blood cell is produced in the bone marrow. The body produces all blood cells in the bone marrow. They push it out into the circulation. They do their job for about 100 days, and then the spleen will reabsorb it. The spleen is an organ on the left side of your abdomen. It's kind of like a kidney, meaning it filters different things. But in this case, the spleen filters out those old or damaged red blood cells, and then the bone marrow produces new ones. So there's always this cycle of fresh blood. So each day you have about a 1% turnover. After 100 days, you actually have 100% new red blood cells in your body. Now, oftentimes people say, well, I just had my blood checked a week ago. I was anemic. I've been doing what my doctor told me. I want to recheck it today. That's not going to work because, as I said, it takes about 3 months for any major changes to be tracked in terms of anemia. So your doctor will usually say, we're going to start you on some medication, come back in 1 month or 6 months or 3 months, and then we'll recheck it and compare it. And that's the most accurate way to identify if the anemia is resolving or if it's still the same as it was before. And then they oftentimes will recheck the reticulocytes to be sure that you're actually producing more red blood cells from your bone marrow. Okay, so microcytic, normocytic, macrocytic. If you are aware of your lab results, you can actually look at them and have your doctor interpret that for you very quickly. Now, what are some of the symptoms for anemia? What are the common signs that people might come to the emergency room or to their family doctor to talk about? The most common sign is fatigue. So if you don't have enough red blood cells carrying oxygen throughout your body, you're not going to feel very well. You're going to feel very miserable, very down. You're not going to be able to get up and run. You're not going to be able to do the things you enjoy. You're not going to be able to go up and down the stairs without feeling very winded. So fatigue is one of the most common presenting signs, and that's why for CBC, it's very easy to rule it in or rule it out when you're in the office. Now, other signs can include weakness, changes in the skin color. Some people look very, very pale, or they may have a yellowish color to them. Some people may have irregular heartbeats, because again, if you don't have enough red blood cells, your heart actually has to work harder to pump whatever it can with the limited supply. And for some people, that causes palpitations or irregular heartbeats. Other people feel very short of breath. They just can't take a deep breath. They're trying to talk, and their sentences are structured in a way that it doesn't really feel comfortable for them. It almost looks like an asthma attack or someone who has emphysema, when in fact, it may not be their lungs, it's actually their red blood cells being too low. And then other people may have chest pain, or they may have cold hands and cold feet, or they may have chronic headaches because you need a certain amount of circulating blood to do its job. And whenever you're deficient, whenever you have anemia, it just isn't going to work. It's too difficult for the body to maintain that. Now, we talked a little bit earlier about what are some of the causes of anemia. So there's 3 general principles of anemia. 1, your body isn't making red blood cells, or if it is making them, it's not enough. So that's a production issue. You're not producing enough red blood cells. The second thing is that you're having bleeding. Okay, so if you're a woman, heavy periods are the primary cause of that. If you're a man, it could be an ulcer that's bleeding in your stomach. If you're someone who just went through surgery or a car accident, that's an obvious sign that you're bleeding more red blood cells and your body can't replace them quickly enough. Okay, so the first one is a production issue. Second one is a bleeding out issue. And the third one is from the spleen, as we talked about. It can destroy red blood cells that are old and damaged, but it can also destroy healthy red blood cells. So if the spleen is overactive, or if the body is absorbing the components of the red blood cells too fast, now you have an absorption issue. So you've got a production issue, a bleeding out issue, and a destruction factor. Okay, those are 3 types. And then we talked earlier again about the microcytic, normocytic, macrocytic. So you can see how we're creating a pathway. Well, if you're diagnosed with anemia, we need to know the size and the shape of your red blood cell, and then we need to identify if you're actually making them, bleeding them out, or if your body is destroying them abnormally. Now, beyond that, there's specific types of anemia, and I'll go through some of those with you right now. So we have iron deficiency anemia, which is the most common type of anemia globally. So we talked about iron is needed for the hemoglobin to work properly. There are some people whose diet is very, very poor. They don't have enough iron in their body or in their foods that they eat, and so they need to have that supplemented. Some people who are vegetarian or they have very strict dietary requirements or they don't like fruits and vegetables, they're going to be at more of a risk of developing these types of issues. And this can be supplemented very easily with tablets. There's even drops for children now. So iron is a very common cause of anemia, but it's also a treatable situation. Now, the only side effect with iron is constipation. So people who do take iron, we always counsel them that you're going to feel constipated because it's a metal. Your intestine has to absorb it, and that can slow down your stool, and then people do feel constipated. So we encourage them to take a laxative or stool softener or honey or something that's going to allow it to be more comfortable for them to go to the bathroom. The second thing would be a deficiency in the folic acid or vitamin B12. Now, people who are deficient in this can be at risk of other problems. So, for example, if somebody has had gastric bypass, so they had a stomach surgery to lose weight, and they're losing weight, which is a great sign, but they're not able to absorb vitamins from their food. Those people have what's called pernicious anemia. And so they actually have to supplement vitamin B12, supplement folic acid in order to maintain their blood cells. How do we know what this looks like under a microscope? Well, these are the red blood cells that look bigger. They look inflated, and that's just part of the pathway. So a small red blood cell with anemia, we're thinking iron deficiency. If it's a large red blood cell with anemia, we're thinking about vitamin B12 or folic acid. Now, people who have chronic diseases are going to be at high risk of anemia. So anyone who has cancer, HIV, rheumatoid arthritis, kidney problems, Crohn's disease, any type of inflammation in the body, that's going to cause stress. And that will definitely be linked with anemia of chronic disease. And then there's anemia from pregnancy. So as a healthy mother has a healthy developing fetus, the baby needs blood cells, and the mother is going to try to balance that out. So a large number of women, probably more than 80%, will be anemic at some point during the pregnancy. And then at the time of delivery, there's a lot of bleeding. They're going to be anemic again in the postpartum, meaning in the immediate term after having the baby. That's expected. And so we encourage women to take prenatal vitamins with iron to boost their red blood cells as much as possible during the pregnancy, and that'll stabilize them after the pregnancy until they get back to their normal functioning level. So if a woman loses a lot of blood during the delivery, how long will it take for her to replace all that red blood cells? We talked about it earlier, about 3 to 4 months, right? So it takes about 100 days to produce more red blood cells. So oftentimes after postpartum, the visit will be at 6 weeks. So if you, as a woman, are concerned about your anemia, you can tell your doctor, and at the 6-week mark, they can get a lab value, and then they can repeat it thereafter if necessary. Now, we talked about some of the destruction that can occur with red blood cells that are circulating. So these are called hemolytic. With hemolytic anemias, the body breaks down the red blood cells faster than the bone marrow can actually produce them. And so these people will have elevations in their numbers because the hemoglobin is broken down and it spreads into the blood, and that causes some numbers that we can actually monitor through a CBC and other testing. Sickle cell anemia is a very common and inherited genetic condition. This is a type of hemolytic anemia as well. The problem in this case is that the hemoglobin and the red blood cell has an abnormal shape. It looks like a sickle, sort of a C shape. And these red blood cells don't go through the small veins and arteries very easily. They get trapped, almost like going through a filter. If you have some backup, the red blood cells can't flow. And these people have severe pain. They'll have pain in their legs or their chest or other organs in their body, and they develop a lot of chronic conditions. Many of these people will actually develop infections, and they can actually die. And so sickle cell anemia is genetic, very high prevalence in African American families. There is genetic testing and blood testing available to diagnose it, and there's various forms of it, meaning some are very mild, some are extremely severe. And then we talked a little bit about some of the ways to prevent it. So one of the best ways to prevent anemia is to modify your diet to include all colors. So any kind of green leafy vegetables, any kind of fruits that have different flavors and colors. If you take iron through natural sources, that's very healthy. Vitamin B12, folate, even things like vitamin C will actually help you with your iron absorption. So we do recommend people have a variety of foods to consume. They can talk to their doctor about a possible multivitamin, and then they can talk to their doctors about any genetic counseling if you're worried about specific genetic types. There are many other types of anemia. We'll have separate episodes for those. There's things like thalassemia. There's things that are related to certain anemias with bone marrow disease. And those are a little bit more technical, but if you have concerns about that, definitely speak with your doctor and they can provide you some more information. So I hope you'll learn a little bit about the anemia and the lab tests and some of the ways to differentiate it the next time you do get your blood drawn.